Coming here to Orca was one of my best experiences. The people, the facility, the equipment, the rehabilitation is like none I've ever experienced. Throughout my recovery experience, I have found that in stroke especially, hope and inspiration are essential. At Orca Center, not only will you receive hope and inspiration, but you'll receive state-of-the-art care from qualified professionals with state-of-the-art equipment and the best rehab I've ever experienced.
If anyone had a brain injury or anything like that, this is something that has to be first on the list. I'm amazed that the soldiers in Iraq aren't being given hyperbaric oxygen treatment. That should be the first thing that they're given. I just don't understand it. After my first series of treatments, and I had the proof of it in the SPECT scans to show the changes in my brain, that indeed there was brain improvement. And I think that anyone who has any issues has to do this first. You just have to, you're willing to try anything to get yourself back. This has got to be on the list. I've tried other conventional treatments, and I really didn't have anything good that happened. This is the first time that I tried something that actually helped me. The SPECT scans, I had scans to show changes in my brain, and it showed changes because I had brain injury, and it showed changes in my brain, which were significant. And the depression that I had, this might be second to that, but I think that's also part of it. Increased change significantly. I saw my primary care doctor, and she had a student running around with her, and I told her what I was doing, and I was feeling better. And he had said that hyperbarics is now becoming a subspecialty in medicine. That's what he told me. I was glad to hear it. So you have to be open to alternative treatments. You get a little leery of them, but when you finally have one that works, you want to share it with people to let them know that they should consider it. That's why I'm here, and that's why I'm doing this. I knew within the first week that I was feeling better, and it was so nice to finally feel better. All you want to do is feel better. When you get sick, all you want to do is get better. You're willing to try anything, and I had tried many alternative treatments.
Data from around the world now is compelling that hyperbaric oxygenation is helpful in these conditions. This, however, is no miracle. With the use of oxygen under pressure, it adheres to all the gas laws of physics, and Henry's law simply states that if you increase the pressure of oxygen, it will be dissolved directly proportional to any of the body fluids. Therefore, we can increase the plasma oxygen for up to 2,000-fold. We can also increase the oxygen in the central nervous system fluid, that is, the fluid that bathes the entire nervous system, brain, and spinal column. By increasing the oxygen herein, we are able to reactivate dormant, idling, sleeping cells that are getting enough oxygen to exist, but not enough to fire electrically. By jump-starting the brain in these children and by giving them a better internal environment for the development of new brain tissue, this seems to be the part of the characteristic features of all of the observations from around the world. As with any scientific procedure, especially new ones, documentation is vital. With newer types of imaging, we are now able to discern the function of the brain even in very early stages. Our choice and the readily available utilization of SPECT, that is single photon emission computerized imaging, gives a functional status of the brain even in infants. This is different from the MRI and the CT scan because they give you exquisite anatomy, and it's difficult to extrapolate between anatomy and function. What we really need to know is what the brain is doing at a point in time, and in order to evaluate any intervention into brain repair, we need functional imaging. Again, our choice has been the SPECT. The normal SPECT will indicate an adequate flow of blood and an adequate metabolism because the tracer crosses the blood-brain barrier. In the patients with CP, we will show you actually disastrous results which have improved significantly with hyperbaric oxygen. The interesting thing is that there's about a 95% correlation. That is, if the SPECT scan improves, the patient improves. So at last we have some type of documentation to guide us with dosage, total number of treatments, and to help us arrive at a prognosis. The first patient, almost 3 years old, had a near-drowning episode 3 months previously and was semi-apolic. According to the pediatric neurologist, his outlook was 0.
Eric was born August 2nd of '93. He was a perfectly normal child until he had a head trauma before falling into a pool, which caused the near drowning. After the near drowning, they told us that he has certain parts of his brain that were dead and has atrophy in the brain. And we heard about the hyperbaric chamber, so we are coming here to try and get some oxygen back into his brain.
The SPECT scan, again, which is a functional image of the brain, showed dramatic improvement in cortical function after hyperbaric oxygenation. It has filled in with areas that were not receiving enough blood or oxygen, and the patient is very much better and has really had a new life.
The Cifuentes family says the medical community can debate hyperbaric oxygen all they want. They've come to their own conclusion as to what helped Eric.
Besides God, I'd say hyperbaric and the therapy he got, but definitely hyperbaric helped a lot.
The next case was a very attractive 14-year-old white female with diabetes. She developed a severe bout of hypoglycemia with seizure disorder producing marked brain injury. She had become almost total care, as can be seen in the video clips.
This is how she was about 2 weeks after her injury. They kept her in a floor bed so she wouldn't hurt herself during her agitation.
Go ahead, Amber. This is your chance to show out.
This is the first time they tried to stand her up. It took 3 people to help her stand up. She had a nose tube at the time where they fed her through her nose. Here she is during therapy. You can see the pain on her face as they try to help her.
The SPECT scan showed minimal cortical function, but after hyperbaric oxygenation, there was a marked filling in of the cortex, and although still patchy, there was about a 70 to 80% improvement in the scan, but the patient now became self-sufficient and is able to attend school.
Okay, she's walking really good. She's got the smiles. She's got the smile, that's for sure. Very good.